Recording in progress. Invitamos para iniciar este nuevo día, acercarnos un poquito, ponernos de pie. Come here, please. En el mundo andino siempre nosotros al hablar de la biodiversidad, está siempre presente también que las decisiones de los pueblos es mantener la biodiversidad. Pero la decisión de los gobiernos está en favorecer a los poderosos y hacer los monocultivos. Esa es una de las preocupaciones que yo tengo. ¿Cuál es el poder que nosotros tenemos como pueblos originarios para que podamos hacer una lucha conjunta con nuestros gobiernos y acabar con el monocultivo? Porque eso está acabando con la vida, está acabando con el entorno. Y quiero que demos una mirada a este altar que hemos construido con los productos que se da aquí en el Brasil. A lo mejor las rosas son de Ecuador, seguramente. Rosas de Ecuador, no sé por qué hacen aquí. Es parte de este intercambio. Quiero pedir que levantemos las manos hacia donde sale el sol. Agradecer al Padre Sol por este nuevo día, para que nos ilumine nuestros pensamientos, pero sobre todo nuestro corazón, para que las resoluciones que hoy tomemos sean desde el corazón. Vamos a dirigir las manos hacia el poniente y que al final del día nosotros veamos que nuestro trabajo ha sido hecho con felicidad. Vamos hacia el norte y pedir a los pueblos del norte que miren un poco hacia los pueblos del sur, que podemos caminar juntos, que podemos sentir la vida. Y vamos un poquito hacia la Argentina, la Patagonia, al Paraguay, para decir a estos hermanos que estamos caminando juntos, que el sacrificio que encontramos en Salta, en el Chocó, en la floresta del Guaraní, no ha sido una sangre derramada injustamente, más una sangre de esperanza, de transformación. Y toda esa alegría del sufrimiento que se transforma en esperanza, que se transforma en semilla de fertilidad, en semilla de nuevas aspiraciones y de encuentro. Vamos a trabajar para que este día sea fructífero. Chasnacachu. Ometeo. Obrigado. Thank you very much. No sé otro idioma. En guaraní, ¿você habla guaraní? Alguien que sepa guaraní para tener presente a ese pueblo. Pai Pai es nuestro ya. Muchas gracias.
Thank you.
Al cruzar
plata que parecía marfil. Al cruzar el puente encontré un tesoro, un niño de plata que parecía marfil. Y lo reviraba y lo reviré. Y le preguntaba, niño bendito, lindo es. Y lo reviraba y lo reviré. Y le preguntaba, niño bendito, lindo es. Buenos días, compañeros, ¿cómo están? Buenos días, ¿cómo están? Bien estoy. Buenos días, compañeros, ¿cómo están? Buenos días, compañero, bien estoy. Y lo reviraba y lo reviré. Y le preguntaba, niño bendito, lindo él. Y lo reviraba y lo reviré. Y le preguntaba, Jesús bendito. Gracias.
Oh. Devuelvo.
Qué alegría empezar el día con con tanta alegría y con esta muy hermosa ceremonia. Muchísimas gracias para esto. Es la manera perfecta de seguir con el día rico que tuvimos justo ayer. Bueno, ayer hablamos de muchos, les presentamos muchísimos temas y interactuamos un poquito, pero hoy empieza el trabajo real en el cual ustedes, todos ustedes, van a seguir dándonos sus consejos y van a seguir desarrollando las recomendaciones que le vamos a enviar a la cumbre sobre medicina tradicional. I'm going to switch to English. Good morning, everyone. It was a wonderful day, a wonderful way to start that day. Thank you all for a very, very, very rich and productive discussion yesterday. And today we look forward to much more interaction. So we're flexible, we're adaptable, and we want to make sure that today you have all the space needed to really develop the recommendations that are going to go to the first Global Summit. But before we do that, we still have, I believe, 3 speakers that didn't have the opportunity to deliver their presentations yesterday. I believe one of them is online with us now. Anastasia Timoshina, who's the Director of Strategy and Programs and Impact at Traffic International, and she's also a member of the IUCN Specialist Group on Medicinal Plants. Do we have you online, Anastasia?
Yeah, hi. Nice to meet you.
Wonderful.
Good to see you.
Thank you very much for joining us. So I'm actually going to leave it to you to present. We want to make sure that we leave a lot of time for interaction, so if you have some time at the end to stay on and answer any questions and interact with our participants, we look forward to this presentation. Thank you.
Thank you very much, and really nice to meet everyone. Very sad not to be here there in person, but thank you for having me. Christina, can I ask if I need to share these slides or whether somebody else will share them?
Una pregunta para el grupo técnico. ¿Tienen la presentación, Pau? Sí. Yes, I believe someone is just uploading your presentation just now, so it should be it should appear on the screen very shortly.
Excellent, good. But I can start without the slides. So thank you for the introduction, and it's my pleasure, honor to be contributing to the global workshop on on biodiversity, health, and traditional knowledge, all absolutely essential topics. I'm going to speak on behalf of two organizations, one of which I think it's the wrong presentation, just to say. Yeah, anyways, I'm speaking on behalf of two organizations and representing two. One is IUCN, so International Union for Conservation of Nature, which has groups of specialists, and one of them is called Medicinal Plant Specialist Group. So I think particularly relevant to this meeting in terms of the reliance on the plant resources. So a lot of my presentation is focused on that angle of connection between biodiversity, conservation, health, and traditional knowledge. And I'm also speaking on behalf of Traffic, which is a global organization working on the challenges of trade in wildlife. And when I say wildlife, I know it translates differently in different languages. We mean a totality of wild species, so fauna, flora, fungi. Traffic works quite a lot around helping to ensure that the trade in wild species is sustainable, legal, traceable. A lot of our focus is on international trade. So again, some of the focus of my presentation will cover that. But let me check. Do we have the slides? Sorry. Maybe I can share the screen now. Okay. Okay, just give me 1 second, please. I can see the screen sharing option. Okay, excellent. So my hope is that you are able to see this. Oh, I think I can see it on the screen. Excellent, good. Okay, so as I said, representing IUCN and Traffic. The first point I wanted to make is on how much or little we know about the use of species, of wild species in particular. And this is the focus of my presentation very much here, focus on wild species. Two reports have been launched last year, and I think they present a first consolidated knowledge from around the world on the use, trade, sustainability of species. So those publications are on the screen. I know they present a global picture, so actually they may not go in enough detail concerning the kind of local level use or domestic use, but in fact they've attempted to do this. In particular, the IPBES assessment report on sustainable use of wild species is an excellent set of resources, over 9,000 references that have been consulted to bring together as much information as possible, including from traditional knowledge practices on the use of species. To quote one figure from that report, and I think that starts helping us think through where we need to be putting the focus on the sustainability of the use of wild species. The report estimates that 1 in 5 people around the world consistently relies on the use of wild flora, plants, fungi, and algae in their daily use. Report also suggests that the sustainability of the use is very inconsistent. So some use is known to be sustainable, a lot of it isn't. And also both of these reports emphasize how significant is the contribution of the sustainable use of the species to livelihoods. And if we think about the livelihoods in a broad concept, including health and income generation, but also sustainable use of species very clearly contributes to the conservation. And so addressing that double threat of conservation of species, negating or adapting to the effects of climate change, and much more. So when I talk about today about the wild plants and fungi ingredients in particular, one of the features that is so have quite a lot of effect, so important in this context is to do with the fact how hidden these ingredients are in consumer goods. I have quite a strong echo. I don't know if somebody can be muted. I don't know if sorry about that. Okay, maybe it's okay. If you go at a shop in any country of the world, and I know this meeting in particular is looking at different levels between local to regional to national to international engagements and collaboration. Any shop would have myriad of final products that may be health products, cosmetic, food that all contribute directly to health. A lot of them do include wild plant and fungi ingredients, but without people actually being able to know what they are, because it's very rarely that the product would say this is originating in biodiversity or coming from the wild species. So the challenge, we start seeing the challenge of this connection between products originating in wild biodiversity and the lack of ability of consumers or supply chains to recognize and hence respond to ensuring that that use is sustainable. Some stats that are really, really important for us all to be, I think, aware of. So the IUCN Medicinal Plant Specialist Group estimates that there is nearly 30,000 species of medicinal and aromatic plants with well-documented use, and many more species that have likely medicinal aromatic food uses, but they're less well-documented in formal systems. And those systems may include traditional medicine systems. They include World Health Organization monographs and so on. So there is this division, but general sense of an overwhelming number of species that is contributing to the health of people as well as other species. The big issue with this data is that we know very little about how threatened these plants are, and fungi in particular. Of 100% of this species, the estimate of conservation status is only known for 19%, which is very, very small. And for that percentage, nearly 10% are threatened with extinction in the wild, which is very, very high percent. So, we talk about some of the critical species that from which the extracts are used to produce drugs, to produce food, and so on. And another, the reason to be picking up specifically on the issue of trade and use as a threat and opportunity is because we know that in the past few decades, there have been quite an immense growth in the international markets, for example. And here I don't even cover the issue of domestic trade, but we know that in the international markets, there have been an immense growth in value and volume of species in use. We've also seen, and this is, part anecdotal evidence, part data collection, that in COVID times, the use of wild plant ingredients and fungi has increased exponentially as well, especially for some species that were known to be contributing to better health, to be contributing to traditional medicines and treatments that could contribute to relieving the symptoms of COVID. So we do know that this trade is very dynamic. It's not statically, it's changing very rapidly. I wanted to show this to remind us all just about the complexity of supply chains, and you can think about it as a supply chain, as a general supply chain example for a traditional medicine or food product or cosmetic product, all of which contribute to the human health and has that connection between biodiversity and health and traditional knowledge. So it's not uncommon for the same species coming from the same place to be used in these parallel supply chains that maybe have a local character. They're used by a patient through the direct relationship between harvester and healer. They could be used locally in the markets, local markets. There could be, for example, muti markets in South Africa, extremely popular for people to shop and to buy products that contribute to their health. There are often parallel national level trade chains or supply chains or value chains, however you like to call them. They have similar meanings, where there are a lot more kind of points in the supply chain that changing hands. Through to the international trade, again, those supply chains are often extremely complex. They could go between different countries, so it's not necessarily always that product goes from one country to another. It's often transformed along the way. It's often sold to one country and then returns to another one. We have any number of examples of trade in traditional medicine ingredients that is transformed in a country and returns to the first country because of the quality and pricing and so on. And the reason I'm showing this picture here is important for this meeting and the recommendations. With this complexity of supply chains, we can see, and the increasing demand, we can see that making direct actions and interventions to address the issue of legality, sustainability, securing traditional knowledge, ensuring equitable benefit sharing is very, very complex, but is necessary to unravel those supply chain, understand them better, and propose interventions in the right level. They may be regulatory, non-regulatory, market-based approaches, and so on. And I also wanted to show you this picture because this is taken from the report I already mentioned, so the IPBES Sustainable Use Assessment Report. It tells us something very important about what makes sustainable use, i.e. type of use that ensures the survival of species and populations, but also benefits of people. What does make the good policy conditions that affect sustainable use of species? I think that's very important, and my hope is that these words resonate with everyone in this meeting. So, some of the enabling conditions for sustainable use, include types of policy conditions that ensure robust institutions, is inclusive and participatory, recognizes plural knowledge systems and values, shares benefits equitably. And if you flip it other direction, there's a number of conditions that make the use less sustainable. So ignoring the rights, ignoring history, overlooking social context, criminalizing the marginalized people, creating power imbalances, and also over-reliance on laws and rules. And this last one is really interesting from my experience, and also from a number of publications written in the past, and a number of programs and projects that we see happening with the trade in wild species, which is often informal, which is often based on traditional kind of supply chains and networks. Under regulation rather than over regulation is often the more recommended way forward. And what is necessary really is a multiple stakeholder governance engagement. So developing, adjusting, responding, using governance systems that are responding to local contexts, and potentially less of the formal kind of laws and rules. So something that Traffic has, and IUCN Medicinal Plant Specialist Group, as well as Food and Agriculture Organization, have been doing in the past year is to create a platform which is called WildCheck, and you have that code in there. But of course, the presentation will be made available as well after the meeting, where the theory of it is, if the information, if this trade is so hidden, if there is so little understanding about which resources are used, which risks and opportunities they face from different perspectives, social, ecological, loss of traditional knowledge. If we start populating this information and make it public access, free, accessible to everyone, to governments, to communities, to businesses, we start creating a positive change where we can see, some of this hidden supply chains being unhidden and actually being celebrated, and focusing on sustainable use. So I'd like to encourage you to have a look at this report. Go to wildcheck.info. Unfortunately, only available in English at the moment. But we're very much looking for collaboration and partnership in this space. This was our first prototype, our first step in this direction. And we think that there is a lot of opportunities for engaging both with international organizations, but also local partners in how we populate this platform further on. How do we create more resources? I'll dive in very quickly in what the platform talks about. I've showed you the picture earlier on saying that there are 26,000 species used for medicinal and aromatic purposes. This is a very, very large amount of species. So how do we start? How do we create appropriate policy responses or industry responses that was actually be driven by some of the highest priorities. So in this process, we have identified 12 species as a first set of species, which we called wild dozen. And you can think about them as the flagships of wild plants trade. You'll notice none of the species here are fungi, but of course fungi is something that we look at very closely in terms of sustainability of use and trade. You'll see a lot of this species, maybe there is slightly quite a lot of species here come from the African continent, but we wanted to make sure that there is this representation of species that are used for different purposes. So some of the species are used in aromatherapy, a lot of them are used in traditional medicine, a lot of them are used in food and very mainstream sectors. So ingredients such as shea butter or gum arabic are used extensively in chocolate production, are used extensively in soft drinks production, and so on. And in all of the cases, the vast proportion of production is coming from the wild. We were also looking at a mix between the different constraints on resource management and the type of responses that were used. So some of these species are CITES listed, so trade in them is regulated. A lot of the species are not. The outcome of our assessment, when we've done it for these 12 species, you see these colors in the column. So we've taken the risk-based approach. So we try to estimate what is the likely social and biological risk from the current supply chains. One of the things that really surprised us, having done this assessment, is how many of these species showed high on the social risk. And for social risk, we developed a whole new methodology, so it didn't exist before, how to think about, for the global value chains, how do we approach social risks, while the biological risk approach is established much clearer with support of the IUCN Red List, for example, and similar methodologies. A couple of words about what we can do. And I wanted to give you an example of a project that we've been implementing in Nepal, in high altitude Himalayas range, with a number of partners, in particular UNSAB and the government of Nepal. The focus of the project initially has been on one particular species that is actually one of those wild dozen species just before on the screen. It's called Jatamansi, or Nardostachys grandiflora, Jatamansi. It is used extensively in traditional medicine. It is used extensively, it's traded extensively in different places. India has a particular traditional market. It has an increasing market in Europe and North America. The species is critically endangered on the IUCN Red List and so threatened by its nature. But here is the complexity of those supply chains and socioeconomic situation. About 15,000 species in Nepal in high altitude areas are estimated to depend on this species for a very large percentage of their income, with very little opportunities for alternative to replace that income because of the terrain they live in, the access to the resources. So a challenging situation which we've been approaching with a set of approaches, which I think is useful in this context, which is why I'm giving this example. So first and foremost, we've been engaging with the governments, and so Nepal government in different ministries, and supporting and engaging cross-ministry collaboration, which links not just the environment, but environment and health, as well as commerce and quarantine authorities. So even though it seems something quite different from a conservation project, which is maybe a primary objective of this work, it is very clear that the bottlenecks in terms of understanding how sustainability and conservation can best work lay so strongly in that interministerial cooperation. So I really appreciate the workshop that we're having now here. We have also been using and relying extensively on existing governance system in Nepal. Nepal has extremely well-developed community forestry system. And so we've been working very closely with the Federation of Community Forest User Groups, and community forest user groups themselves are the units that are managing the forest areas in Nepal, through management plans, through the monitoring programs, through the use of the resources, and allocating the roles and responsibilities within the communities for management of the resources. This decentralized model of resource management for non-timber forest products, so in this case plants, but also plants and fungi and potentially animals as well, is extremely effective and is such an excellent way and demonstration of what the dispersed governance could look like and where some positive opportunities are. We've been finding kind of issues around more systemic change that we could contribute to with the project. So to give you an example, we've been each community forest user group is meant to have operational management plan that covers the issues of resource management as well as traditional knowledge. We've been working with community forest user groups not to create any new management plans because that's not necessary, but to bring in some elements of non-timber forest product management, monitoring, resource assessments and inventories into those plans so that the information that they produce can be quite easily connected to also what the government is requiring at the central level, at the national level, and also in the international trade, because these species are traded internationally very extensively. And finally, we've been using something called Fair Wild Standard, which is a standard developed specifically for wild collected plants and fungi. And this experience has been very interesting because it really focuses on a market-based approach and a market solution or contribution to this situation. Because in addition to creating conditions for verifying sustainable harvesting from ecological perspective, with that word fair in the standard, it requires the demonstrated equitable relationship and agreements put in place between the buyers and the harvesters being organized and taking responsibility and given the responsibility for decision making about the resources use, financial resources use, as well as the use of the premium fund, so a basic fair trade system. This has been very important contribution, and it also allowed us to connect much stronger to the international markets, because the companies on the international market do know that this species is threatened. So for them, demonstrating that the government has approved the exports and imports, but also that the certification has clearly demonstrating the compliance with this independent voluntary set of requirements is essential. And it gives them confidence that they could then communicate to consumers. So a really round-up project that I think touches on a number of issues that we discuss here at the workshop. And I think this is my final slide, like really bringing these things together on some priorities around trade and use of wild species. One thing to say, I think sustainable use and trade in wild species does provide an important contribution to the conservation of species and ecosystems and multiple socioeconomic benefits. I have deliberately boldened the word sustainable in here because I think quite often there is a miscommunication about whether it's about any use and trade, but of course a lot of use and trade practices can be unsustainable even though they're legal. So this emphasis on sustainability is important, and my hope is that the recommendations to the summit could come out with a strong message around this. There is a whole range of tools, and they're both policies and non-regulatory measures, such as standards that can support the implementation at local, national, global levels. I think it's essential that any recommendations emphasize the use of best practices for safeguarding the resources. And there is a lot of, as I was trying to demonstrate with Nepal example, there is a lot of learning between resource-rich countries that can happen in this space in terms of how the resources are managed, what are the systems that are used, what are the standards that are used, and regulations. If we replicate the pilot models that have been developed in different places, and I gave you one example in Nepal, but of course there are multiple cases of where we know how things work. We know that the good practices can be implemented. They really can lead to an overall positive impact on conservation and long-term availability of resources and habitats, as well as improvement of income from trade. The issue of income and equitable benefit sharing is extremely difficult, and it's really essential that both in terms of the kind of the whole concept of sustainable use of resources and how much that is contributing to it, but also quite often we see a lot of disbalance in value chains in terms of who's benefiting. So when we talk about the benefits, are they accrued in the right places? Are they accrued by the people living with wild species? And also how other users can benefit from it. Being at the World Health Organization organized workshop, I wanted to draw attention to guidelines on conservation of medicinal plants that WHO, IUCN, WWF, and Traffic have developed, and they are, they're available online. And I think they need to continue featuring strongly in those recommendations around traditional medicine practices as a connecting point and emphasizing how important the conservation of that wild biodiversity is. That so much of the traditional medicine, drug discovery, food security depend on. There are some really interesting and positive national initiatives in traditional medicine sectors. So for example, there is currently ongoing development of risk assessment guidelines for the traditional Chinese medicine sector by the China Association of TCM. Those experiences definitely need to be encouraged, shared, and replicated, in particular with countries with well-developed traditional medicine systems, because there is so much that can be said about the sharing between and inspiring this sector. And maybe more in this space of jump through the few action points, maybe more in the space of cooperation. I think the interagency coordination mechanisms is so essential. And so, very pleased again to be part of this workshop, which connects the health, the biodiversity, traditional knowledge issues. These conversations are a prerequisite for any successful implementation at the national level. I think I'm going to stop at this and going to also invite you. I know a lot of people in the room, I'm sorry I can't see you all. I know a lot of people in the room have incredible experiences and degree of specialism and interest in conservation of medicinal and aromatic plants in particular, and fungi. Please do get in touch. And the group, IUCN Medicinal Plant Specialist Group, has over 100 people, and all regions are represented, but I think in particular for the Latin American region, it's not a well-represented region, and I think we should definitely be getting more participants. So please get in touch, check out the WildCheck platform, and very pleased to contribute. Thank you.
Wow, thank you so much for that, Anastasia. It is a lot of information that you have so usefully condensed into a short period of time, but I think it's incredibly useful a background as we move into the subsequent sessions throughout the course of the day, which will feed into the recommendations. So very important considerations on the regulation, trade, the sustainable use of wild species in supply chains, the governance and ensuing policy responses, how this all ties together and how they need to be considered moving forward in the development of recommendations. Also, thank you for sharing with participants who may or may not be aware of the resources. There are quite a number of resources that are out there on this, including the guidelines for the regulation of medicinal plants that were jointly developed by WHO, IUCN, Traffic, and WWF. So we'll be sharing that presentation with all participants. And hopefully also taking them into account in the development of the recommendations as we break into the contact groups later this morning. And actually still building on that supply chain complexity, one of the elements of that are precisely the economic parameters of the healthcare system in relation to traditional medicine systems. So I think that this presentation, in addition to providing numerous new and very valuable elements to the discussion, is also a very good segue into the presentation that we will be having from Dr. Saifullah Khalid Adamji from the United Arab Emirates. Anestia, please stay on the line because we've only got 3 presentations and then we're going to have a bit of a discussion before we go into the breakout group. So thank you enormously for that.
Good morning, everyone. I wish all of you had a very healthy breakfast. Okay. I don't hear anyone saying yes or no. Okay. All right. That's good to hear about it. Okay. Thanks a lot. Thank you very much. This is the topic. Why did I select the topic? This is the most important thing. Aspect actually to be discussed. I'm not a very expert into it, but I have worked little bit closer with the UAE government and government of India as well, up to some extent, like, what kind of economic policies, what kind of economic regulations need to be developed, need to be designed in order to take the healthcare system of traditional system to be aligned with the modern medicine. Okay, so I'm going to talk a few slides over here. What exactly it says? Okay, applied economics. It's a chapter where designing an economic policy to lower the cost in healthcare sector. The modern medicine, of course, which we are relying on nowadays and should be, why not? Because it has progressed to such a level where it has produced the evidence, where it has convinced the people that why do we need the modern medicine? We can't do without that. Having said that, okay, but it does come with a high cost. Okay, I'm going to go to a hospital or a primary healthcare sector or for any kind of disease or any kind of element. Surely my doctor, my healthcare provider would charge me a lot. Okay, if I do have an insurance, where most of the people I would say do not have it. In the developing countries or even in the developed countries, we can't cater the insurance for each and everyone. Naturally, so what do? We look for an alternate way. Okay. So what exactly is I'm saying? The impact on environment, the climate change, the biodiversity, has an effect on the health of the nation. So the sustaining and reaching out health for all is not possible. As we spoke earlier, yesterday, today also, we had Dr. Anastasia reaching out about the biodiversity and the loss of biodiversity, how it's causing the economic loss to the government, and it's leading to the climate change and the temperature rise and the wiping out of the species from the world. How it's affecting the health also, healthcare sector as well. So what do we have to do? What's our role? How do we can help out? So this is then an alternate plan to be designed to tap the traditional knowledge of indigenous tribes or indigenous people. We call the tribals in India, and in Arab world it's called Baddus. Okay, where they carry the traditional knowledge of curing the elements from generations. Okay, so can it be used in place of well-established healthcare system, but in a very effective manner? How it can be used? I'm just going to give some more examples for that. Okay. Okay, so this is just it's a WHO model actually, where the multi-sectoral policy and action would be required to build up, and we need to empower the people and the communities, okay, to achieve the goal of health and well-being. The primary care and the essential public health care function as the core of integrated health services. Why it is necessary? Why it's essential? Why it is so important? Because the primary care is the basic care where it starts right from the, you can say, from your kitchen, from home, from yourself, okay. And then it goes to the level of medical practitioner, and then so on, primary, to secondary, tertiary build up of the healthcare system. So what exactly, how we can empower our traditional people, our society, our communities to take care of our health in our own way, okay. So this is something which I have in my mind, pass module, okay. Why do I call it a pass? We don't want to be failed. Do we? We don't want to fail, okay. We want to move ahead, okay, in the life. So this is what exactly a pass module would depend upon definitely the social and political environment of the prevailing in the country, and it should be a people-centric. The policies should be the people-centric, not against the people. And it must take care into the economic condition of those people for whom we are talking about. Okay. So what exactly is the plan? The plan is to identify the sector and the groups. Divide the sector as per the geographic locations. Okay. Not as for the Google map. Okay. Just do it like, through your own geographic locations whichever country you're belonging to. Identify the prevailing use of biodiversity elements in each sector group and enlist them into medicinal subgroups such as animal kingdom, plant kingdom, marine biology, so on, and elemental biology, elements, the chemicals and all those things, yeah. And now, so we need to, after the grouping that this group has this much of medicinal plants, this much of marine biology over in this area, and the group second has this kind of thing, enlist them. And meanwhile doing this, keep an eye that we are not endangering, we are not touching the endangered plants or animal species. Okay. Then we move on to encourage the investment in this sector to provide livelihood for locals in healthcare sector, taking an utmost care to protect the environment. Of course, while doing this, we must also think that we are trying to provide the livelihood for the local people, for the traditional people, indigenous people. Okay. So what is the second action? Action is the training and the capacity building of IP. IP stands for the indigenous people to adopt the scientific methods. Then extend traditional knowledge to be converted into medicinal documented database. Okay, whichever the plants are there, we must study them in detail, like the ethnobotany and the phytochemistry, and encourage the bilateral partnership of indigenous people with private pharmaceutical companies to carry out research and development so as to develop low cost but effective medicinal drugs. Now the third, supervision. There has to be a return on investment, which we are investing. The pharmaceutical companies are going to invest in this particular area, in Brazil, in Paraguay, in Argentina, in Colombia, or in whichever part of the world you can say, India. Then the time-bound action plan and its implementation. Auditing process to see whether the particular module is functioning or it requires modifications. To cross-check whether the plan is result-oriented, whichever the plan which we made for this specific community. And the final impact on health of a nation, adoption of coexistence module. Bearing in mind the lowering of expenditure on healthcare sector, we must be able to judge the impact on general economic condition of a country, how much we have been able to support the indigenous people and have a positive effect. And of course, the last slide is the sustainability. As I call on this a continuous effort to reduce the cost of healthcare using integration. In fact, it's a coexistence, it's not integration. So we are coexisting with our modern medicine brothers, and then coexistence of traditional knowledge into scientific medical database and its application in parallel to modern medical system. This effort will lead to increase the acceptability of traditional system of medicine and will fulfill, if not fully, but partially the evidence-based medicine theory. This is all I have to say. This is all I have summed up with, because the time is very short. And of course, the other speakers are also there. And I hope that we will be able to achieve our goals. Thank Thank you very much. Thanks a lot. Obrigado. Muchas gracias.
Thank you so much, Dr. Adamji. That is terrific. That is more food for thought. And actually, you know, one of the things that immediately jumped to mind as you were going through some of those recommendations is how it ties into one of the core questions that we had been asking even in the first 2 days of the workshop. So one of the questions you'd asked was, can traditional knowledge be used instead of the traditional healthcare system to achieve health for all? But I'm wondering, and this is just a question, why does it need to be an either or? One of the things that we had been doing a lot of in the first 2 days of the regional workshop was talking not so much about substitution and certainly not about integration, but rather complementarity. So I think some of the questions that you raised are very interesting and will certainly spark a lot of discussion around complementarity as well. So a lot of added value to have that presentation. Thank you very much, Dr. Amanji. And now let's bring it back a little bit to the ground. We're a little bit behind schedule, but it's going to be very short. We're going to have maybe just 10 more minutes, which are going to bring this back on the ground, specifically in Namibia. So I'm very, very pleased to introduce Dr. Wolfgang Henkert, who is a traditional and complementary medicine practitioner. Where did he go? Oh, there he is. Complementary medicine practitioner who is going to speak to us a little bit about those on-the-ground experiences. So welcome, Dr. Henkers. Where is it?
So, welcome everybody. Thank you for having me and my ideas. Just need the translators to translate this. Okay.
Is the microphone on?
It is. This one is on? Yes. So the World Health Organization defines traditional medicine as the sum total of the knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health, as well as the prevention, diagnosis, improvement, or treatment of physical and mental illness. Everyone is arguing over its name. Some call it spell work, others call it prayer, the next calls it manifestation, and some call it traditional, customary, pre-Renaissance, or even quantum physics. No one is denying its existence. When we stick to this WHO definition of health, then it is rather modern medicine that is the complementary specialization to TM. One cannot ensure a respectful dialogue with TK communities and TM systems without acknowledging the embeddedness into metacognitive beliefs about the quality and nature of reality that contradicts the Western lenses of sense-making and generally established epistemologies. TM-TK communities and practices move in non-Cartesian and sometimes in non-Newtonian spaces. You will thus find all traditional knowledge and traditional healing systems worldwide at the crossroad of non-anthropocentric worldviews. This has already been highlighted by IPBES in its methodological assessment report of 2022 on the diverse values and valuation of nature, but it remains as yet uncodified and completely misunderstood. Here I'm quickly looking at some differences, commonalities, and similarities between traditional and modern medicine. We're looking at knowledge protection, which is open access for traditional, but totally the opposite for modern medicine. We are looking at formulation, how do people arrive at a certain dosage and intervention. This happens during a consultation with a patient, which can sometimes be 2 hours or longer for traditional medicine, which is different from modern medicine. They look at years of preclinical and clinical testing and ideal formulation. We look at availability, which is decentralized in traditional medicine, and it's centralized and often difficult to reach, especially in Africa. Traditional medicine has no boundaries. It is the result of a non-anthropocentric worldview. Inasmuch as nature is available to all and the substrate of everything, traditional medicine is an anthropological collective mirror of that. Such knowledge is normally shared freely, and money often is not an adequate exchange for that either. The consequence of this is that TM is patient-centered interventions, and it happens within the community. The evidence to this is anecdotal and has been happening for millennia, and you cannot just dismiss this as old wives' tales. The immediacy of this approach is currently unrivaled by modern medicine, and a possible approximation into this direction is the advent of telemedicine. Modern medicine, on the contrary, takes an outcomes and evidence-based approach, which clearly has different parameters. The immediacy of this approach is unrivaled by traditional medicine. Here we see the differences and commonalities in the space of research, which is really limited. It lacks funding, full stop. And there are various attempts, such as, I think the TKDL is overtaken. Is it replaced by a new model? Okay. Okay. Whereas modern medicine is highly funded, the regulation is virtually none for traditional medicine and highly regulated for modern medicine. We spoke about the approach and the testing, which there is none. There is anecdotal evidence in traditional medicine, and for scientists that is the lowest form of evidence. If we understand that there are many ways to make sense of the world, and if research indicates clearly that traditional and complementary medicine is adopted by the majority of people in the world, then there's absolutely no reason to maintain that TNCM should not be introduced to and made complementary or even included in primary health care or even standard medical care, including regulation and health coverage. The coexistence of traditional medicine and modern health care requires open-mindedness, cultural sensitivity, and collaboration between different stakeholders, including governments, healthcare providers, researchers, and communities. This could be a prime marketing and awareness drive for the next few years. Here we are looking at the differences in terms of dosage and the consultation, which is lengthy. We spoke about that already, because symptoms are always only the visible part. And modern medicine really focuses more on the symptom. If you've got a headache, you get a headache tablet. In traditional medicine, the headache might be related to something totally different. So even on training, there are commonalities in that traditional healers get many years of training. We are not born like that overnight. People grow into families of healers. They grow into that knowledge. They learn plants from their grandparents or grandmother or grandfather, and then perhaps from their parents or aunts or uncles. It is alive. It is a life school they go to. You can see the applicability. This is a holistic lifestyle approach. Traditional medicine is about your beingness in this world. Whereas modern medicine is a good solution for acute afflictions. When your bone or when your leg is almost severed, they will fix it. Traditional medicine cannot help with that. Okay? So there's no reason to exclude the one in favor of the other. Both have their place and their time. With regard to the acceptance and usage of TNCM, it is important to note that TNCM is commonly used but seldomly talked about. Here we find comments and outright dismissals of TNCM as wrong, poisonous, blasphemous, demonic, black, African. And yet, traditional medicine is the go-to medical intervention for some acute but mostly lifestyle-related diseases. Modern medicine, however, specializes on acute illnesses and sickness, and although it does not fare well with chronic diseases and lifestyle approaches, it often is blindly accepted, used, and not questioned whatsoever. Research findings into contact theory suggest policies that keep people separated, such as redlining or de facto segregation, are likely to help make prejudice thrive. This is a comment from an expert panel of the OHCHR, and it relates to the war on drugs. Now more than ever, the international community must replace punishment with support and promote policies that respect, protect, and fulfill the rights of all. You could transplant this directly onto this space. And to keep a marriage healthy, the first thing is to honor the relationship itself. For traditional medicine, this is your relationship with nature. It is not a question of integration, but coexistence. The preceding slides have shown that we are trying to squeeze the TK and TCM space into a scientific framework of reductionism, with the result that the TM space gets shamed and blamed. Accordingly, the realities on the ground show a profound disconnect from the entire superstructure of the WHO frameworks, strategies, and guidelines. There are many points one can look at, and I've listed a few immediate points with regard to the Namibian conditions in the next slides. I'll quickly read that for the translators to translate. Key messages and reflections on the Namibian experiences. Point A, while traditional healing commonly exists alongside conventional health practices, legal definitions seem to remain work in progress in Namibia. B, unless thoughtfully established, compliance monitoring will add additional cost and burden to an already stressed system. I can assume this counts for other countries in the world as well. Understanding that traditional medicine will continue to exist regardless of efforts to place them in legislative boxes, the proposed draft legislation has considerable shortcomings that make it unworkable, despite best intentions. Keywords here: policy, legislative, systemic bias. The consensus finding process in Namibia is slow and often marred by preconceptions, religious influences, and diverse economic interests or influences. Where resources are limited, a possible introduction into the national healthcare system would entail compliance monitoring that needs to be staffed and financed. Potentially, this is in a direct competition with pen and paper for schools, or medicines and supplies for the existing health system. Considerable experiences have been accumulated and developed over the past millennia with respect to methods of preparation, selection of herbs, identification of medicinal materials, and the best time for obtaining various different plants. Most of this TNCM knowledge has not been codified, and the chronic disease epidemic of the world is urgently looking for answers. Point D, the COVID pandemic showed clearly that A, public health systems do not even closely know how ill their populations are, and B, public health establishments across the world lost confidence of its citizens. Systemic anthropocentric biases of traditional and placebo lead to bioadversity instead of biodiversity. And one should not forget that without the TM support, the last pandemic would have caused a more severe collapse of public health systems than it did. Point E, TNCM is a system of careful relationships with people grown over generations. Trust is an essential component that may not be lost. Which begs the question whether the entire discussion is less a technical but perhaps a societal problem. There not only is a need for educational intervention, but introducing TNCM into the curriculum of medical students, but also does the topic require more exposure to the public, especially as TNCM sees the future of public health in individualized medicine rather than standardized medicine. This is a systemic anathema. Point F, protecting biodiversity equals protecting cultural diversity equals traditional knowledge community protection equals traditional and complementary medicine protection. And when we understand that protecting these TK and TM communities equals biodiversity and cultural protection, we meet the understanding of the populations of this world around TK and TM with commensurate acknowledgement towards frameworks, strategies, and policies. The broad spectrum of approaches to traditional medicine and all attempts to define and classify have revealed complex terminology, historical antecedents, and diverse cultural meaning. Our words and phrases carry images, concepts, and therefore implications. Words are not simply identifiers, they are idea clusters, constellations. So there seems to be a marked disparity between the knowledge about and the acceptance of traditional medicine with medical practitioners, even though outside academia, the world looks totally different. The current approach in Namibia is TM doesn't do damage, but also no good, so no need to regulate. The keyword here is paradigm of pluralities. And this needs to be fostered. This hands-off approach, following heated discussions and toxic lashing out from various corners of society, did not result in a discourse that needs to happen. Neither from academia, nor from government, and also not from any NGO I'm aware of. Especially not with the aim to foster, design, and implement a paradigm of pluralities within the TK-TM space. Point I, most medical doctors have no knowledge about TM, not even about, say, nutrition. If I'm right, they do it for a month or two. When we combine both healing traditions, TNCM and modern medicine, we arrive at a framework of integrative health. This could act as a framework for institutionalizing and operationalizing mutual understanding and acceptance. TM practitioners have no access to insurance cover and no access to medical aid cover in Namibia, even if the patient preferred the TM treatment route. The markets are segregated and segmented. Keyword here is industry capture of markets. In Namibia, the market is so small that we would have considerable backlash from established industries to allow users to use TM in an official way. In addition, most TM practitioners experience marginalization, stigmatization, dismissal, racism, and religious dogmatization. Keyword, educational bias. Here's a hot word, decolonize scientific discourse and interaction. The scientific paradigm dominant in many healthcare systems often favors evidence-based medicine and standardized treatments. This is perfect for acute conditions. Traditional medicine, on the other hand, relies on knowledge passed down through generations and may neither fit the scientific framework nor should it. This misalignment can create barriers to the acceptance and integration or simply tolerance of traditional medicine in or adjunct to healthcare interventions and or facilities. Similar to different prayer rooms and different bathrooms at, for example, airports and other public infrastructures, you could have additional T and CM facilities in hospitals where patients could receive non-allopathic interventions. Point L, TM played and continues to play an important role in mental health matters of the population. Keyword, preventative healthcare. In the end, it is important to uphold patient charters and remove cultural biases and prejudices that not only impacts the patient, but also impacts TM practitioners to only have access to a segregated and segmented market at best. This is a quote from a book called The Biophilia Effect. Spending time in a forest activates the vagus nerve, which is responsible for inducing calm and regeneration. And spending just one single day in a wooded area increases the number of natural killer cells in the blood by almost 40% on average. You will see that all traditional knowledge and traditional medicine systems are living mystery and wisdom schools. The message of TK in TM communities across the globe is very clear. As per the first slide, shame dies when it is told in safe places. The reconnection with nature is a fundamental part of human health. And if nothing else matters, this could be a prime driver for biodiversity protection, including the human ecosystems that developed around, about, within, and not without it. A coordinated treatment approach that combines conventional and complementary medicine is known as integrative health. Integrative health aims to heal each person and maximize their quality of life by treating their physical, mental, and emotional health. Individual needs will determine the best combination of therapies. Healthcare professionals, such as doctors, nurses, and therapists, could very well work with complementary therapists to create a treatment plan. This plan can treat all aspects of a person instead of focusing on one area of the body, even though conventional and complementary treatments have benefits, drawbacks, and interactions to consider. And so I would like to thank you for this opportunity, and here's a 15-second summary of a 15-minute talk. May you be safe, may you be healthy, may you be happy, and may you live with ease. Thank you.
Wow, Wolfgang, I am floored. I thought this presentation was the absolute perfect bridge between the global component of the workshop and all of the issue areas that arose in the regional component of the workshop. I thought it was very clear, very simple. The comparison, the tables where you're comparing, we're making a comparison between either the perceptions or the realities between traditional medicine and modern medicine are extremely useful, where, you know, and they raise a lot of the points that had been raised in the first 2 days of the regional workshop. You know, how do we address the fact that in modern medicine, clinical trials still are perceived as the gold standard of an evidence-based approach? What can we really consider as evidence? You know, how do we address the challenge of knowledge that has not been codified, but that needs to be taken into account? How do we ensure that complementarity between traditional medicine and modern medicine? I mean, there are so many. I can't obviously repeat them all here, but I thought that the way these were presented was very clear and a really, really very, very useful bridge between the global and the regional workshop that we had. And I think it can help us to raise a lot of questions, and is a wonderful segue into the rest of the day. Because the rest of the day, that's exactly what we will seek to be doing. Our colleagues, Bertaluz, Pineda, and Jesus, have worked so hard to actually try to bring together they tried to consolidate all of the different recommendations that had been discussed over the first 2 days of the workshop. They've done a wonderful, wonderful job in doing so. And there are now 6 different categories under which these could be placed. And I think a lot of the questions that were raised in the different presentations in terms of regulations, in terms of cost, and all of the issues that were raised in Wolfgang's presentation at the end that really summarized a lot of that, will be an opportunity now for all the participants in this room to really come together and say, well, what are the implications of this? Can we find some common ground to make some global recommendations to the first Global Summit on Traditional Medicine? So I actually going to ask a question now. Would participants, maybe we can just do it by show of hands. Sorry, Daniel, I'm flipping things a little bit. But are there any burning questions or comments that people have on the basis of these presentations, or would participants prefer to maybe raise those questions in the course of the discussions now that we're going to move into, in which we hope everyone will participate? So it's an actual question. I realize now that it wasn't like a yes or no question, so how are people going to respond? Are there any burning questions? Yes.
Not so much a question, but a reflection. In all three presentations, there is one particular element that is not coming through very clear, and it is the spiritual dimension of traditional medicine. I think it was our Indian colleague who yesterday said there is the bio or the physical illnesses, then there is the cognitive illnesses, the mental one, and then there is the spiritual one. And that one is not receiving a lot of attention, and perhaps it needs to come out a bit more. The other presentation spoke about biotrade and bioprospecting, but there is now the bridge of digital sequence information, which parties have agreed, benefits will be shared. They're looking at the modality and process of how that should be done, and perhaps it will be useful to reflect not necessarily on how it will be done, but the implications of such a system eventually on traditional medicine. Thank you.
Very good. Excellent. Thank you very much for those additional reflections. It's wonderful to have them from the CBD Secretariat because I think it will help us in the discussion.
Muy buenos días, Panamá, Aristela Blandón. Yo más que todo quiero felicitarlo e invitarlos a los que siguen allí como expositores a hacer incidencia en que debemos de prevenir, y la medicina tradicional hace eso. Sin la prevención no estuviéramos la salud y las cosas que tuvimos con el COVID. ¿Cómo podemos masticar esto o procesar esto? Que nuestra alimentación, nuestro vivir, ¿no verdad? Nuestros entornos son sanos, y eso es prevención. Hay muchas cosas ahora que hacen y creo que nos están matando porque hemos olvidado la tierra, la que nos alimenta, la que nos da todo. Entonces, en vez de ayudarla, apoyarla y amarla, como nos sostiene, pues decimos tenemos que pisarla, y no debe ser así, porque de ella vienen todos los alimentos. Y los invito a que hagamos incidencias en la forma de cómo prevenir enfermedades, porque no tiene que ver absolutamente nada con la edad, no tiene que ver absolutamente nada con la etnia, tiene que ver por lo que entra por tu boca, ¿sí? Y por lo que entra por tus oídos, por lo que pisas y por lo que haces, por lo que sientes, tiene que ver la buena salud. Los felicito, su exposición fue espectacular, ¿no verdad? Muy entendible, muy clara. Y para mí, cuando mencionan la prevención, ya están dando algo a los humanos. Gracias.
Muchísimas gracias.
Secretario Buenogel, soy Nancy de Guatemala. La verdad, muy agradecida, muy revitalizada el día de hoy por encontrar la ruta hacia dónde dirigirnos y encontrar el camino. Porque de alguna manera en la mesa regional dijimos somos nuestra región, sentimos, tenemos el mismo sentir, nos identificamos con lo que todos traíamos en nuestros corazones. Pero el día de hoy es una manifestación de que la forma de sentir del ser integral está en toda la madre tierra, en todo el universo, desde todas las culturas milenarias es el mismo sentir. La persona vista de manera integral, no separada, no fragmentada, porque somos parte de ese universo y por lo tanto lo que le pase al universo lo vamos a sentir nosotros. Agradezco mucho esta última exposición y la penúltima porque nos dan la base científica que estamos queriendo encontrar de cómo nuestra sabiduría ancestral tiene o no tiene, es válida o no es válida, quién lo dice o no. Estábamos comentando con los grupos regionales donde decíamos, cada cultura, cada ciencia, sea medicina tradicional, ancestral o biomédica, tiene su epistemología, tiene su forma de ser y todas contribuyen de la manera que sea usada va a ser la diferencia, pero cómo nosotros queremos adoptar y lo respetemos desde nuestros espacios, esa es la clave. Muchas gracias.
De nuevo, muchísimas gracias a la Organización Mundial de la Salud por abrir estos espacios de comunicarnos, de sentirnos toda nuestra sabiduría ancestral aquí presentes del mundo. De mi parte también agradecer la ponencia que usted hace, el sentir de la Madre Tierra, en donde nosotros como humanos a veces causamos mucho daño. A mí me surge una inquietud para acá discutirnos. Hay mucha cosa que no están en los territorios, están en los museos, que hace parte de la espiritualidad, tanto en Europa como aquí en Latinoamérica, en todos los territorios. Y esa ciencia, esa sabiduría está reclamando que repatrien a los territorios. Entonces, en las discusiones que vamos a tener ahora, tengamos en cuenta esa partecita. Lo otro, aquí en Latinoamérica tenemos los pirámides, tenemos nuestros sitios sagrados, también están intervenidos. Entonces, que haya ese respeto a los pueblos originarios, que nosotros fluyamos de allá, toda esa sabiduría que en algunas cosas está encerrada. Entonces queremos abrir ese espacio para la humanidad, pero con toda la ciencia, con toda la sabiduría, como somos los pueblos originarios, para ayudarnos entre todos, de sanarnos entre todos sin mirar diferencias. Entonces, que tocamos esos temas también. Y también que de este taller y también de este foro y también del foro mundial que va a haber en India, que de allí salgan tareas a trabajar en las regiones, tanto en Latinoamérica como en el mundo. Que los gobiernos también entiendan, que los gobiernos locales, departamentales, nacionales también entiendan esta situación, este llamado que estamos haciendo del calentamiento global y de la biodiversidad. Entonces, te dejo esas inquietudes. Gracias.
Fue un poco complicado entender, la traducción no me queda muy bien, pero quiero felicitar. La dosificación de las plantas medicinales, nosotros no lo medimos en miligramos ni las pesamos, sino las sentimos. Es un diagnóstico dado desde el corazón, de lo que yo siento cuando miro a la persona, cuando puedo leer cuál es el desequilibrio que se produjo en su cuerpo espiritual, en su cuerpo emocional, para llegar al cuerpo físico. Entonces, la sistematización presentada por usted, mis respetos. Y en estos encuentros deberían estar las personas que toman las decisiones de cada uno de los gobiernos, porque de no nos quedamos solamente en estos encuentros donde pensamos las soluciones, pero esas soluciones no llegan al pueblo, no trascienden. ¿Cuántos encuentros ha tenido la OPS? ¿Cuántos encuentros, cuánto camino tiene la OMS y cuánto hemos caminado? Cuando nosotros en el COVID presentamos las alternativas de las plantas medicinales para enfrentar, nos dijeron, eso no está comprobado, eso no es científico, eso no sirve, pero estamos sanos. Estamos sanos. Nuestros pueblos, nuestras comunidades están sanas. Se habla de la desnutrición y somos ricos en biodiversidad para fortalecer desde la alimentación una salud preventiva. Nosotros no creemos en la salud curativa. Preveemos, por eso es que nosotros hacemos los rituales para prever qué es lo que hoy vamos a decir, qué es lo que hoy vamos a hacer. ¿Qué estamos haciendo con el monocultivo? Cuando grandes extensiones, por el dinero que da el monocultivo, por el dinero que va tras los transgénicos, por el dinero que va por los abonos que vienen con el monocultivo y destruyen nuestra biodiversidad y cambian el pH de nuestra tierra y cambian todo el sistema de vida que se articula en la madre tierra. Eso tenemos de alguna manera que aportar en estos encuentros. Decir que la investigación no es solamente desde el cerebro izquierdo, tiene que ser usando los tres cerebros, porque nos debemos a la madre tierra con el cerebro bajo, nos debemos a la vida con el cerebro derecho y al conocimiento con el cerebro izquierdo. Y los tres tienen que estar en armonía con nuestros tres mundos, el Hanampacha, el Caipacha y el Ucupacha. Estos tres mundos no son dispersos, son uno solo. Esa trilogía es una sola. Y no podemos dividir esto por aquí, esto por acá, porque todos somos una biodiversidad, pero una unicidad en relación con el cosmos. No sé hacia dónde vamos, pero sí quiero tener una esperanza. De que aportemos en nuestros últimos tiempos una mirada hacia nuestra madre, la madre tierra.
Buenos días. Para mí, para conclusión, vamos concluyendo estos temas tan importantes que es la biodiversidad, la medicina tradicional. Llevo muchas preguntas en mí, pero también los que van a ir a la India tienen que llevar propuestas, de verdad, un plan de justicias para los pueblos indígenas. No solamente hablo de México, yo creo que es a nivel mundial estamos viendo, pero estamos enfocándonos, como decir lo que acaba de dar el hermano, muy interesante, muy puntual las participaciones, pero creo que ayer en estos primeros días se hablaron de los instrumentos internacionales. Creo que nos tiene que hacer eso, es respaldarnos como pueblos, como nación, a nivel de la humanidad, vamos a hablar. nosotros que somos unos pequeñitos que acá ahorita yo creo a algunas personalidades que se encuentran acá de la ONU, de la OPS, de la OMS. Creo que eso es muy importante, fortalecer y darle seguimiento, pero también las personas que están son los primeros que están estos organizadores. Si no le dan seguimiento, yo nada más van a venir a ocupar un puesto y se acabó el compromiso para los pueblos. Realmente hemos existido y seguiremos existiendo en la humanidad, ¿sí? Con dificultades como lo que pasó en la pandemia en esta ocasión. La pandemia fue algo que nos hizo mover a todos como pueblos, como humanidad, ¿sí? En mi caso muy personal, yo no usé la vacuna y no creí esa medicina. ¿Por qué? Porque la mente estaba enfermo antes porque nos estaban atemorizando. ¿Quién estaba? Es como ver una película, es como ver un terror que te está poniendo enfrente y tú te atemorizaste ante esto. Me quiero quedar aguardadito en mi casa, ya no hago nada, ya no voy al campo, ya no hago esto, me encierro porque me pega la enfermedad. Pero si tú no tienes confianza contigo mismo, con Dios, con la madre naturaleza, con la tierra, con el agua, estamos viendo hoy en el día como decir, yo porque estoy enferma, yo porque estoy, mi mente está enferma, ¿por qué? Porque por lo que estoy viendo, las películas, los medios te están acabando también, hay que ver eso, hay que como de tomarle una medida a esos medios que nos están matando a nuestros niños a través de, esa es una enfermedad también. A lo que me refiero ahorita hoy de la medicina moderna, de las plantas, de las plantas medicinales, conocimientos tradicionales, pues que no quede en papel, que realmente a todos nos llegue, se nos considere, se nos tomen en cuenta como pueblos indígenas, no a veces sí es bueno tenerlos acá. Estamos en el caso de la política económica, ese también tenemos que ver, de la madre tierra, pero también las plantas están enfermos. Ahorita en mi pueblo se está contaminando, yo quiero sembrar esto, pero hay tantas plagas ahorita que los alimentos no se dan, las plagas que están abajo de la tierra, las plagas que se están acabando, entonces la subsistencia, y creo este refuerzo me pareció muy importante, todos esos temas hay que lograr. La propuesta que es que ustedes realmente lleven a cabo y realmente también sí estamos vivos, sí necesitamos ese apoyo y sí a todo a nivel mundial. La madre tierra seguirá siendo nuestra madre tierra, hay que cuidarla y lo tenemos que cuidar todos. Gracias.
Então, bom dia a todos. Eu sou Mara Lúcia Costa, eu sou daqui do Brasil. E eu acho que a apresentação dele, ele me inquietou com algumas questões, né? Que eu acho que vem desde o primeiro dia, né? Quando a gente estava trabalhando exatamente nos grupos, né? Quando eu vejo exatamente a chamada, né, daqui do workshop, né, e do fórum, quando fala de biodiversidade, conhecimento tradicional, eu me solidarizo, né, com os nossos, né, os irmãos que estão aqui exatamente colocando as questões relacionadas, olhando e trazendo o sentimento deles, né, para poder lutar, né, que não fique apenas num papel, né, como foi colocado hoje, mas que se torne realmente uma realidade. E aí eu me coloco como um lugar de uma mulher negra, né, afrodescendente, que eu vejo que também existe um conhecimento, né, da nossa tradição e que não está sendo colocado aqui, que precisa, né, que todos também tenham esse conhecimento, né. E no dia do nosso trabalho, no nosso trabalho em grupo, a gente fez questão de colocar exatamente, por mais que a gente tenha colocado que seja olhado para todos os segmentos, mas que a gente coloque exatamente os indígenas e os afrodescendentes, para que a gente realmente não continue na invisibilidade como a gente está até hoje, né? Então, essa inquietação, quando ele trouxe isso para cá, isso tá essa inquietação vem desde o primeiro dia, né? E eu acho que é importante, né, e para os próximos, né, até pela palestra riquíssima, o conhecimento riquíssimo que todos os palestrantes trouxeram, mas que isso também esteja na mesa, que isso também seja levado em consideração e que isso também seja pautado para todos os países, né, e que isso seja realmente colocado em prática. Então, Então, essa é minha angústiazinha, né? Mas que eu acho que a gente pode evoluir nisso, né? E a gente está aqui exatamente para isso. E eu, né, me coloco como parceira, né, da OPAS para a gente poder trabalhar em relação a essa questão, tá? Eu sou do Ministério da Saúde. Eu trabalho no Departamento de Prevenção e Promoção da Saúde, lá na Secretaria de Atenção Primária à Saúde. Então, a gente está trazendo essa pauta para dentro do Ministério e a gente se coloca em parceria com vocês para a gente poder levar isso e colocar isso em prática. Tá bom?
Muchas gracias. En primer lugar, felicitar las conferencias, todas muy interesantes, y este taller. Yo soy Berta Luz Pineda, trabajo con el Organismo Andino de Salud Convenio Hipólito Unanue, y me parece que es fundamental que reconozcamos que todo esto que hemos dicho está atravesado por el modelo de desarrollo vigente, un modelo de desarrollo que reproduce, aumenta, agrava desigualdades múltiples, étnicas, de género, desigualdades que cada vez se agravan más y que se ven reflejadas en los problemas ecológicos que también inciden en desigualdades. Es fundamental contribuir a la construcción de sociedades con más justicia social y, por supuesto, con más igualdad en la garantía de los derechos. En el Organismo Andino de Salud tenemos, por ejemplo, un plan andino de cambio climático. ¿Por qué? Porque estamos viviendo una crisis planetaria, y esta crisis planetaria es una crisis de pérdida de biodiversidad, mayores desigualdades, mayor producción de desechos. El cambio climático lo que refleja es seres humanos que hemos incidido en aumentar problemáticas que antes eran fenómenos naturales, pero que ahora son y se agravan producto de nuestro modelo de desarrollo vigente. En el Organismo Andino de Salud también estamos trabajando con la Organización Panamericana de la Salud en la elaboración de una política andina de reducción de desigualdades. Necesitamos reducir desigualdades injustas e innecesarias y trabajar para contribuir a construir en la vida cotidiana y en las políticas modelos de desarrollo más sostenibles, menos extractivismo, más protección y cuidado de la naturaleza. Gracias.
Bom dia, meu nome é Edivânia, sou Xacreabá, indígena, né, Xacreabá, e eu queria tirar uma dúvida aqui na apresentação do colega que falou por último. Talvez eu entendi errado também, né? É porque, da forma que ele falou, que ele citou que a medicina tradicional ela não tem dono e, portanto, não tem como ser regulada, né? Então, se não tem que ter posse para ter regulamentação. E uma sugestão seria a integração de ambas, por exemplo, com as práticas integrativas, para que dessa forma pudesse ser legalizado o uso de forma legal. Mas, se for essa sugestão, me preocupa o seguinte, porque, como todos colocam e entendem, né, que tem sua especificidade, as medicinas ancestrais, tradicionais, que, diferentemente de práticas integrativas. E aí, por exemplo, se a gente faz isso, confesso que eu já pensei isso, porque muitas vezes, quando falava medicinas tradicionais, eu acreditava que incluía as medicinas indígenas. Então, eu ia pesquisar, tinha os cursos. Falei, beleza, vou fazer, vai ter sobre as medicinas indígenas também, mas nunca aparecia. Sempre medicina ayurvédica, medicina chinesa, mas não falava de medicinas indígenas. Então, se a gente faz essa junção para que seja, de fato, então, reconhecido e legalizado, mas aí a gente cai no perigo de descaracterizar, né, o real sentido das nossas práticas, das medicinas indígenas, ancestrais. Foi essa dúvida que eu tive. Não sei se foi isso que ele quis dizer, né? Que a integração poderia ser uma opção para que, de fato, pudesse pensar em regulamentação, pensar no uso legal E por que não pensar, por exemplo, em estudo de caso? Se a gente tem muitos casos, na realidade todo mundo se cuida, funciona. Para a gente funciona, para a ciência não, mas assim como a aromaterapia, por exemplo, baseada em evidências clínicas, por que a gente não pode usar isso também como uma ferramenta para as medicinas indígenas, afrodescendentes? Enfim, foi uma inquietação e uma dúvida minha. Obrigada.
Thank you very much. We're going to be taking... Muchísimas gracias. We're going to be giving the floor to the other side as well. I know there are several people that would like to come in, but I just wanted to say thank you so far for everything that you have shared. It's very valuable, I think, and this is exactly the aim of this workshop, is to have this exchange, not only from within the region, but across different regions. And so I would like to, after this, encourage people from other regions to maybe respond to some of the concerns and questions raised, because there is no, uniform there's so many worldviews, and there are so many interpretations of what traditional knowledge and traditional medicine means, and I think it's really important to be able to exchange and share further on those worldviews. So I would just like to encourage people from the other regions to also come in and maybe respond to some of the questions and concerns. Sorry, before I move on to this table, I was trying to go to the tables. Was there anybody else at that table? No, maybe not. I know this gentleman has been very, very patient. But we're right here, so Jeffrey, are you sure?
Muchísimas gracias, buen día. Pues nada, abrazo a mi hermano en el alma, compartimos el mismo sentimiento y vamos en unidad. Felicitar al doctor Wolfgang. En verdad, la sistematización y el análisis comparativo en palabras muy sencillas llevan a esa parte que, si bien no es la verdad final, no es la verdad última, sí empieza a dar luces, ¿no? Empieza a dar luces de cómo se puede convivir y se puede avanzar en esta gran diversidad. Y menciona algo que no es nuevo, pero que hay que reiterar tantas veces como sea necesario, el tema del recurso para la investigación. Por un lado, los recursos son abundantes, ¿verdad? Pero por otro lado, los recursos son mínimos. Aun cuando desde el lado del conocimiento indígena, de los pueblos indígenas y afros, ahí ya empieza a haber muchísima evidencia, como lo demuestra en su cuadro, ¿no? Anastasia, de la USN, efectivamente hay una demanda extraordinaria de ciertas plantas con principios activos, producto del conocimiento tradicional de esas plantas, y hay una sobredemanda, y luego hay todo un tema de plantíos extraordinarios, ¿no? de monocultivos, y eso efectivamente lleva a abonos, a agroquímicos y a alterar los ecosistemas, que te llevan necesariamente a un tema de cambio climático, necesariamente. Y cuando tú metes esos monocultivos, pues obviamente empiezan a desaparecer algunas plantas, y con ellas desaparece conocimiento indígena ligado a la biodiversidad. Y entonces, si la USN, ¿verdad?, saca diferentes directrices y modelos, e incluso en su momento el tema de áreas naturales protegidas, cómo no actúa ahora, ¿no? o debiese de actuar en el tema de regular estos monocultivos. O sea, con toda la incidencia y el poder que tiene a nivel internacional, pudiese hacer estas reglas. Por el lado del doctor de Emiratos, efectivamente se trata de fortalecer a las comunidades en el tema de salud y en el tema de alimentación, pero no se trata de imponer, de llevar modelos nuevos. Se trata de fortalecer y refrescar los que ya existen, porque si no entonces sobrepones y ahí hay todo un tema también de alteración cultural. Y si bien las sociedades vamos en cambio constante, como la evolución del ser humano, ¿verdad?, y de todo el planeta, bien hay cosas que pueden seguir conservándose y preservándose para el bien de la humanidad. Ya no se trata de llegar a imponer, porque si no entonces estás desplazando. Y creo que sí se puede trabajar con algunas farmacéuticas, bajo el modelo de ética y respeto y el principio de distribución de beneficios y consentimiento libre, previo e informado, y no de llegar y hacer biopiratería, bioprospección y extracción del conocimiento, porque si no entonces seguimos practicando y practicando lo mismo, y todos estos eventos y otros a nivel nacional, regional e internacional, pues se quedan ahí en eventos de los cuales parece que únicamente hablamos pero no aprendemos. Y entonces narrativas como la de la hermana de Panamá, que tarda 3 días en llegar, etcétera, y los tiempos extraordinarios que hacen o hacemos para venir, ¿en dónde se quedan? O sea, tenemos que aprender a revalorar todos estos esfuerzos para seguir caminando y compartiendo como humanidad en esa diversidad cultural que somos esta humanidad, ¿no? Sería todo. Muchísimas gracias, doctor.
Muchísimas gracias a usted. And I'm actually very excited to pass this microphone to Dr. Jeffrey Roth from the UN Political Forum for Indigenous Issues, because it's such an important forum in which to raise some of these issues. And I personally would love to hear about how the forum can be leveraged to bring in some of the concerns that have been raised here, in addition to everything you were already going to say. So,
thank you. I first want to say that, you know, I have been trying to not intervene so that we can hear from our traditional leaders and from our elders. So I thank you for the knowledge that you've given here, and I appreciate that. You know, one of the issues that I have a little bit of concern about is these sessions have really felt like there's been a focus on there's been more of a focus on how to make a commodity out of traditional medicine and traditional knowledge, and in many cases not even really acknowledging where things have come from, where knowledge has come from. So I'm concerned. Okay. Well, I want to start over then again and say I want to thank the elders and I want to thank the traditional leaders for allowing me to speak here. I've been trying to listen and hear that. So I want to tell everyone that that's very important. I felt a lot of the interventions and discussions here have really been more focused on how to make a commodity out of traditional medicine or how to integrate it into larger systems without the actual free, prior, and informed consent of indigenous people and without really respecting the UN Declaration on the rights of indigenous people. And that concerns me. We have, in some of the regions where we've had presentations from, we have member states of the UN that do not acknowledge that they have indigenous people. And that's a problem, you know, and yet want to integrate and create these traditional systems for everyone. And are actively working against indigenous people. And so that's a real concern to me. And I think at least in this region, we're still at a phase where we're trying to formalize and create a system for it. So I think we need to be extremely, extremely cognizant of, as our elder from Colombia said, the intellectual rights of indigenous people and ensuring that there is a request and permission given to share this knowledge, because that is a very important part of it. I have three things, so that's my first. The second one, I really, and I have discussed this with Jerry, that the conversation, especially around the CBD and other mechanisms that are following around the designation of indigenous people and local communities is very problematic for indigenous people. The Permanent Forum has been extremely clear on that by using that terminology, we are co-opting or minoritizing our indigenous people. The rights that are for indigenous people do not transfer to local communities. This does not mean that we don't support local communities and their rights to participate as stakeholders in conversations around biodiversity and conservation. But we need to protect the rights of indigenous people and the voices of indigenous people in the systems. And unfortunately, the CBD has not listened, and other mechanisms across the UN have also started to adopt that. And we will, you will hear from indigenous people about that. We will not stand for that. The other issue that I want to talk about is as we move into creating the recommendations that we need here to take forward. I think some of these, we should have had a little bit more equal balance. I think we needed to hear from the traditional leaders more. And I felt like this was, not all of the presentations, please, don't think that it's everybody, but we needed to have more of a dialogue between traditional healers and indigenous people and then interventions. This felt like a parade of interventions, looking for approval. And that is not necessarily the best way for us to get to recommendations that come from indigenous people. So I want to hope that we can keep that in our minds as we look and move forward on these recommendations. Because, you know, these are our knowledge holders, and these are the people that need to lead this conversation and lead us forward. So thank you.
I still would like to see, I mean, we're going systematically table by table. We also have, I believe Anastasia is still on the line. I'm being motioned by translators. ¿Hay traducción o no? No hay traducción. oye. You can. Is my. What? Okay, I think we are having some technical issues with the translation. Estamos teniendo unos problemas técnicos entonces con la traducción. Así que le voy a hacer una proposición, una propuesta. I think la voy a hacer en inglés y en español porque no la sé hacer también en portugués, sino la haría también en portugués. Entonces, esta es la propuesta que les hago. Teníamos un coffee break que estaba planeado. Así que si ahora les propongo unos 5 o 10 minutos para el coffee break, para que puedan comer algo y un café. So I propose maybe a 5 to 10 minute coffee break, and in that time, maybe we can fix technical issues. Yes, but there's no translation, so there's no point if people can't understand. There's no translation. This is the problem. So the reason we're proposing a coffee break is not to interrupt the dialogue, but because we need translation so people can understand each other. La razón por la cual estamos proponiendo este coffee break no es para interrumpir el diálogo, es porque no hay traducción, no está funcionando, así que si continuamos el diálogo no van a entender. Muchas gracias. Entonces regresamos dentro de 5 o 10 minutos. We'll be back in 5, 10 minutes. Yes, I'm just gonna grab something. Thank you so much, everyone, for coming back. Muchísimas gracias a todos y todas. Hemos tenido un coffee break muy fructífero porque hemos visto también que habían mucha gente de diferentes regiones que estaban hablándose y para ver cómo se pueden avanzar las recomendaciones. So that was a very, very useful coffee break. I'm glad to see that there was so much dialogue between and among participants and that so many questions were being addressed. We had a minor technical issue with translation, just very small glitch, which was fixed very quickly. And I think that all the translation is now working well again. Yes, I see some thumbs up back there. Or ¿funciona la traducción ahora? Estupendo. Todo se resuelve al final. Todo se puede resolver al final. So, para cerrar, before we go into breakout groups, antes de ir en los grupos de trabajo, que es la parte más importante de este diálogo, I promised that I would allow everyone who wanted to continue intervening or making an intervention. We had some wonderful, wonderful interventions from many of the tables before. So before we move on to the next topic, I just want to open that up and see if there are any others that would like to weigh in. I know that there was a question that had been addressed to our last speaker, Wolfgang. And Wolfgang is now making some copies of the presentation because I know that many of you have asked for his speaking points. So he's not in the room, but we'll give him a chance to say a couple of words to answer the questions that were raised before. ¿Hay otras intervenciones? Are there any other interventions you would like to make before we start to introduce the two topics of the breakout groups? Amazing. Okay, so I think we're all ready and excited to move into these breakout groups. So we had some questions that were being projected here on the screen. Could we ask the technical team to maybe put those questions back up? Las que estaban en la presentación PowerPoint, las dos preguntas que estaban en este... Sí. Esas, ahí están. There they are. Okay, so I'm just going to give some context for those who were not at the regional component of the workshop in the first 2 days. So these are the core questions that we are seeking to answer collectively to begin to draw out some elements of the recommendations. And there was extremely rich discussion during the regional workshop around these two questions. They're in Spanish on the screen, so I will do my best to try to translate them into English now. Or actually, better yet, I will read them in Spanish and our translators will translate those questions as well. But anyway, in any case, how can traditional medicine systems and biomedical systems complement each other? So be complementary to contribute to health and well-being. So this was one of the core questions, and a very rich number of suggestions and discussion points had been raised around this question. The second question was, what are the arguments and necessary actions to be taken to create win-win strategies to protect biodiversity and create health and well-being promoting environments. So those were the two questions. Recommendations had been made by each of the breakout groups during the regional workshops around these two questions. And Bertaluz and Jesus, do we have we have Bertaluz right here, and we have Jesus. Jesus is just entering right now. Ahí. That very kindly grouped, consolidated all of the inputs. Do we have another slide in which we show the titles? Into these, oh, ¿dónde están? Ahí, there. Oh, how come we see it here, but we don't see it here? They had divided those into 6 broad categories. So the first, oh, and now we've lost it on the screen. So when technology is